Tune in Saturdays at 1 p.m. for the Your Body is Your Pharmacy radio show. Hear from the doctors that were among the first in the U.S. to merge the ancient wisdom of Ayurveda and natural medicines with the advances of modern medical science. Listen to pioneer doctors Virender Sodhi, Shailinder, and Anju Sodhi to keep up with some of the latest medical advances and learn from some of the true leaders of Ayurvedic medicines every Saturday from 1 to 2 p.m. with the Your Body is Your Pharmacy radio show on Desi 1250 a.m. Radio that listens to you. If you or someone you know is diagnosed with cancer and is interested in adjunctive holistic approach, please come and meet our doctors at Ayurvedic and Naturopathic Medical Clinic or call us at 425-453-8022. That's 425-453-8022. Are you looking for quality Ayurvedic and naturopathic treatments for your chronic issues? We offer a holistic, wholesome approach to living with chronic diseases. Call us at 425-453-8022 for more information. Panchkarma detox treatments are a great way to utilize natural healing mechanisms of the body. Our clinic in Bellevue, Washington offers over 36 years experience in Ayurvedic treatment. Call us for more information about our Panchkarma treatments at 425-453-8022. That's 425-453-8022. If you're suffering with diabetes, heart disease, hormonal issues, digestive issues, and other chronic health issues, we offer comprehensive Ayurvedic and naturopathic treatments to reverse your diseases. Call us at 425-453-8022 for more information.
Good afternoon, folks. This is Dr. Shailinder Sodhi along with my co-host Dr. Anju Sodhi. Hello, Dr. Anju.
Good afternoon, everyone.
Yes, and today's topic is a very interesting topic we have, and it's all related to the female hormone replacement therapy, and a lot of people come and talk to us about it. So I think you have seen your share of patients, Dr. Anju, and people asking for HRTs and and what we suggest. So this whole hour will be discussed around the hormones and the benefits, pros and cons, and what is really true and what is not true about all these big about the hormone replacement therapies which people wants to go on, and if it's really recommended.
Yeah, we get all the time. I get a lot of women patients, like the perimenopausal and the menopausal, for the asking for the help. And we know that it's like when we were in India, I never saw my mom complaining about the menopausal symptoms as much as the perimenopausal. A little bit, but it was not a big deal at that time, I believe, or in India.
Well, even in today's world, even if you look into all those people who are living in the remote areas of India, or even here, even the people who are much more in the natural settings, usually you don't find them complaining about getting any hormones or any issues around it.
So yeah, that is very much true, and that does tell us that why is that the factor? Why is it like that? Because in the old time, the food was very clean.
Right.
And people were doing exercise, and all the air was clean, so everything was clean, and there was not pesticides were not used into the
they definitely played a huge role.
That plays the huge role, I think.
And also, not only the pesticides, as we are advancing, we have added few of our own things to our life, like all the makeups and the perfumes.
Everything.
All
that contributes to.
Right. And the plastics have taken quite a bit toll in our kitchens. They are everywhere. So the plastics, different types of, and the way we cook our foods, the microwavables, and all that had played a huge role in affecting the female hormones as well as the male's hormone as well. I would not just say the females are only the on the other side. So male have been affected by it too. So folks, if you have question regarding the hormone replacement therapy, or women those who are listening to this radio show today, and if you are having some female hormone related question, I have Dr. Anju along with me. She will be very happy to answer those questions. In order to call to the studio today, it's 1-844-301-1250. Again, I will repeat the number 1-844-301-1250. That's the direct line to the studio, and we have wonderful our the radio engineer, technical engineer Liz sitting with us, and she'll be taking your call, and so she'll be passing on that to us. So अगर आपको कोई हमारे साथ प्रश्न पूछना हो, आप हमारे साथ हिंदी, उर्दू और पंजाबी में भी बात कर सकते हैं. आज का जो टॉपिक है वो है हार्मोन्स पे. जो वीमेन, जो स्त्रियां हैं, औरतें हैं, उनको जो हार्मोन रिलेटेड इशू हो जाते हैं, जो उनके प्रॉब्लम हो जाती है, उसको हम एड्रेस कर रहे हैं. जैसे कईयों स्त्रियों को माहवारी का इशू होता है, मंथली पीरियड्स एंड उन सब को. तो अगर उसके रिलेटेड इशू है तो आप हमें कॉल कर सकते हैं, एंड वी विल बी वेरी मच हैप्पी टू टेक योर कॉल. तो हमारे साथ आप हिंदी, उर्दू, पंजाबी में बात करते हैं. तो डॉक्टर अंजू, टू कैरी ऑन दिस, so what are the the real issues which we face in this current era, I mean, which we
So,
notice?
like we all like the mostly people know that it's like the women they know like what is the how the hormone plays their role into like that into the cycle, like the monthly cycle.
Yeah.
So like in the when they get the period, usually the normal pattern is like from 26 to 28. 28 days is the like really good, like the moon cycle, like they will have the period. So, but it can be like couple days early or couple days late too. So, which is a little bit hormonal impact. So, some women, the periods are pretty normal. They will be having the regular periods and not any like the further symptoms, like which the PMS symptoms we call. So that is could be secondary to like there be a little bit of the hormonal imbalance. Due to that, they will have some symptoms. So when this period, like when period starts, like the hormones start declining, it will be like after the age 30, 35. Actually, the slowly hormone starts
And
declining.
some of the literature even tell, Dr. Anju, that our hormones start going toward the declining phase age 20 and onward. Though
Exactly.
it's a very slow
It's
decline.
slow, but
very slow decline.
Yes. So at age 20, it's at the higher peak.
Right. And after that, it's usually...
It start declining slowly. And a lot of time we get like the these days the girls, they don't want to have conceive until the late 30 and then they are having some problem conceiving too.
Yeah,
so
that's an issue. So you mentioned about the PMS, and a lot of our audience may or may not be aware of what that PMS mean. Would you please just describe PMS?
So PMS is the premenstrual syndrome. So a lot of girls complained about feeling like the abdominal pain, cramps, irritability, sleeplessness, sometimes too, anxiety.
And sometimes cravings of different food.
Craving of the different food is very common in the girls too. Like they will be craving either the, I have
Salt
noticed more the sugar side
sugars,
than the salt, but salt also. So like they don't eat chocolate, but they will be eating like a lot of chocolate during that time.
And the water retention.
Water retention, yes. So in some patients, it would be really obvious and they want to get treated. So then they have like the hormone, like they want to do something for it. Then they traditionally they recommend.
Right. The irritability is the huge issue, which I notice even the patients comes in around the cycle or sometime in ovulation phase. So that usually an indicator that there is some sort of a hormonal imbalance is going on.
That is very much right.
And even some people have, I have seen couples who come to me, and I know you have seen lots of female patients in your practice. So the husbands will say, all of a sudden the personality change during that. So that's an indication of imbalanced hormone, and we try to address that
and also like as we mentioned earlier, the food impacts on this, like how the eating habits are. This will affect your monthly cycles too. So, like they go for sometimes they seek help and they go for the birth control pills.
Right, and that's very common. Like, I mean, the young girls who are having PMS, painful periods, severe pain, cramping.
And they can have like excessive bleeding too.
Right,
So there can be several things.
And they then the parents or even the young girls, they'd like to seek the help, and they usually put on birth control pills or some sort of a hormone therapy to get that cramping easy to make it, and there's usually underlying factors which are causing that. So and that's how the hormones comes in the life in the women's that we are introducing, maybe starting with the birth control pills.
Yes, so that is the like when if sometimes I get the girls like they start birth control pills very early, which we are not in the favor of. Like
there are pros and cons.
There is pros and cons. There it can be like the
short-term help maybe.
Yes, but like there is several other things can be done if they are taking birth control pills not for the birth control reason but for to balance their hormones. It can be corrected by dietary modifications and by taking some herbal supplements and stuff which
and
helps
isn't
to
it
balance.
that always true in the young female population? If we look into their lifestyle, how they're eating, their diet, how they're living their day to day, and usually there is a common links which can be related, and that which leads to the hormonal imbalance.
Yes, very much right. And so that can be, I'm trying to say that can be corrected with the easy lifestyle change rather than taking the hormones.
Right. So, it shouldn't be the first approach. The first approach is seek a help, and that is try to find what can be done differently before we put you on a hormone. And I'll tell why we both actually agreeing on, I and Dr. Anju both are agreeing on not to be on birth control pills or hormone pills right at a first visit. But it's because there is lots of complications when we put people on hormones. And those complications are not very, I mean, some of the complications are as bad as that you can develop a thrombus or clot and can throw emboli, and which can be
and
very
plus
devastating.
It's the estrogen, which is like we are putting extra estrogen in our body, and like we do not need that, and it gets accumulated in the different parts of the body.
A lot of people sometimes notice that when they go on birth control pill, even though their periods are maybe taken, but then they have side effects, which is either sometimes they gain weight or they are actually noticing other things, which is like their behavior pattern is not the same, and the long-term effect that we know the estrogen can be cause of cancer. And if there is a family history of either breast cancer, ovarian cancer, or uterine cancers, which can be actually correlated with exogenous estrogen,
and then it's contraindicated.
Right. Well, then still we say, well, the hormones which we have in today's birth control pills or other are not the same as we had in in 70s or 80s or in 90s. So there have been modifications. That's probably true, but still the risk factor.
Factor is there, so always seek the help the other way.
So when the people are coming, Dr. Anju, it's like so our approach, like you and I, you mentioned that we want to look into the lifestyle, the dietary factor.
So definitely we want to look into the lifestyle, the how, how much stress is in their life, and what are the eating. Like usually it's like the girls, like the young girls in their 20s or the late 20s. And then focus on like how are you eating? Are you eating outside mostly? Are you eating a lot of sugar? Are you having a lot of just the refined food, or like just
or the fast food,
or
right.
Are you eating the whole grains? Are you eating just look at all those things. Are you eating the vegetables and fruits? Are you drinking enough water?
Majority of population, the young, rather than water, they go for the
pop or the sugar drinks or the juices. All these things are bad for you. So yeah, that can need to be seen, and then there is always we have a different Ayurvedic approach too, and also the with the dietary modifications there is we can help them with the some herbal supplements too. So which is we get the good results with that.
So that is in the this is for the young population. So all those young girls, those who are suffering with the hormonal issues. So jumping into the hormonal pills or birth control pills is not always an answer, but it is a fine. It may be a short-term goal, but the long-term goal is we need to balance out your hormones.
Balance out the hormones, and that is doable.
And it is very much doable, and we do it all the time.
Yeah.
And so what else they should be paying attention, especially the young population I see is quite heavy on the makeups and the perfumes and the
because
sprays
that
and
has
the
all
deodorant.
the parabens, and these are the like that this affects your hormones, and that this is can be carcinogenic too.
Right.
So if they are using the cosmetics, they need to look into like if how much, what are the ingredients, and if it has the parabens or not, or like the phthalates, and these are the really bad for you.
And actually they mimic like hormones.
They mimic like hormones too. So you need, and it's these days there is so many things available. You can really like it may be a little bit more expensive. The
getting the good quality.
Getting the good quality and without the parabens, because without the parabens it has the short shelf life, and that is the issue too sometimes. But it's not too bad. It's
well,
not,
if you're going to put something on your body,
Yeah.
then it better be clean.
Exactly. And same thing with the some girls like they like to use the lotions all the time. And how about the hand sanitizer? They are using the hand sanitizer so much, and that has the bad effects as well.
Right. So is all these are the chemicals, folks. So when we're addressing the hormones, it's important that as much clean you can live, that's better. The reality is hormones are so sensitive. Even small peak going up or down, it affects the whole well-being of the individual.
Yeah, and like then it's some people say that okay, like why the other person who is doing the same exact thing is not having the symptoms, but I'm having the symptoms.
Well, we consider that's an individual.
Yes.
That every individual is very different,
Very different.
How our body detoxes, how our liver handles the toxic load is totally individual. It's very different. So that's where the Ayurvedic constitutions and Ayurvedic typology comes in the picture, and we say it very much. Every human being is not built the same.
Yes. So then I will like to talk about like the perimenopausal and the menopausal after the
Short
talking
break,
about the, after we take a short break.
Okay, Liz, so we will take a short break. So folks, we're talking about the bioidentical hormone replacement therapies. And in order to call us at the studio, it's 1-844-301-1250, 1-844-301-1250 1250 पे आप हमें कॉल कर सकते हैं. And we are talking about the bioidentical hormone replacement therapy.
Panchkarma detox treatments are a great way to utilize natural healing mechanisms of the body. Our clinic in Bellevue, Washington offers over 36 years experience in Ayurvedic treatment. Call us for more information about our Panchkarma treatments at 425-453-8022. That's 425-453-8022. Are you looking for quality Ayurvedic and naturopathic treatments for your chronic issues? We offer a holistic, wholesome approach to living with chronic diseases. Call us at 425-453-8022 for more information. If you or someone you know is diagnosed with cancer and is interested in adjunctive holistic approach, please come and meet our doctors at Ayurvedic and Naturopathic Medical Clinic or call us at 425-453-8022. That's 425-453-8022.
Good afternoon, folks. This is Dr. Shailinder Sodhi along with my co-host Dr. Anju Sodhi. So thanks for staying with us. And we are talking about bioidentical hormone replacement therapy and its effects. And before break, we talked about a little about how the young women's can be taken care the first choice. So now we are going to go a little bit next step, which is the perimenopausal and menopausal women. So, Dr. Anju, can you just discuss about that?
So I'm going to talk like what is the perimenopause. So women after the like late 40s to 50s, they start noticing their periods are not, menstrual cycle is not the same, and they are either having the very heavy bleeding sometimes, and sometimes they are skipping a period. Periods are not like 28 30 days, but it's maybe like 6 weeks to 8 weeks, and sometimes they complain about passing a lot of blood, and sometimes it's just the spotting. So this is all due to our hormones are declining. Our hormone, it's not nothing wrong with it. It's a normal physiological phenomena of the body.
Only if it is around the age when we expect
when
it.
we expect it, yeah.
Sometime, Dr. Anju, in some cases, I have seen few cases where women in mid-30s start having these issues too.
Yes, and sometimes it could be, Dr. Shailinder, genetic too.
Right.
So what age their mother had, the grandmother was like the menopausal, they stopped having their period, and yeah, we do get these type of and then we need to
those
look.
are less.
Those are less, but that's not like that need to be addressed, that need to be seen, and their hormonal evaluation, and that can be corrected by giving them, because the hormones are definitely not normal in those individuals, and we can really help them with the dietary modifications, and also like some by using some herbal supplements which helps to balance, which works on the body's organs to balance the hormones. It's not the hormones, but it's like balances the hormones. It's like it's a fuel for our own organs.
So so some of the perimenopausal you mentioned that, and it can linger on for many years.
It can linger. Sometimes it can linger on for many years. Like they will be having, and that stage is called the perimenopausal. Like sometimes they will not have period for 6 months, and then all of a sudden they have the period. So when we call it menopause, it's labeled menopause as when they have not had a period for full 1 year.
Right, and that means it stopped completely, and they have not had a period for 1 year, and
most of the women then they do not get the period, and some cases like they may get slight bleeding or something.
Right.
So then then what are the change when they are having the menopausal symptoms? So what would be the symptoms they will be noticing? So most of the cases I have noticed they complain about the disturbed sleep. Mm-hmm. They cannot sleep. Insomnia is a big issue.
Hot flash is another one.
Hot flashes is the other issue. Night sweats is the other issue, which really and then they complain about having this in the nighttime more, and that's the reason for not to sleeping well also.
Right.
And then there is like the other ones too. Like the poor concentration or the memory loss. They can't remember the things like they used to. I get this all the time. And then also like the depression, anxiety is the other.
Right. And I think the depression and anxiety is just an indication of how the hormones are going down, especially the estrogens, is going down. And also the progesterones are getting lower. So that sometimes, like I said, it changes the mood. Right in the beginning, we mentioned how hormones can really play with our moods and how we behave. So that may be another reason why depression might hit, or anxiety or panic attacks can happen during this phase.
Okay, and then also like there is like the thinning of the skin, dryness, vaginal, like the thinning of that vaginal canal too. Some women complained about like having lot of like the vaginitis kind of issue due to that too.
And those are the infections.
And also the reduced libido. So there is several things women experience with this decline of the hormones or the menopausal stage.
And the long-term effects of menopause, which we all worry about, is also we talk about the calcium depletion.
Osteoporosis is the like the big one.
Osteopenia and osteoporosis,
Osteopenia.
and that happens in the population who actually the population which I worry about in the ad is actually the young girls who all of a sudden had menopause. Say somebody who's mid 40s or 40s had menopause, and they are the very high risk
Yes.
patients, because not only we concern about the bone health, but also the cardiovascular health.
That is very much right. So then, like, what to do?
Right. The things that Dr. Anju, like we said, we actually have all our listeners, those who are staying with us, probably understanding and probably getting scared. All of a sudden, we have brought the cardiovascular, blood pressure issues, osteoporosis, that's thinning of the bone and prone to fracture.
Again, I will add that not all the women will experience with the menopause. It's nothing to worry about. It's a normal physiological phenomena of the body where with the menses the period starts, and with the menopause the period ends. So, but like these hormones play such a big role in our life, and and you will see that if women their lifestyle was always good, they're exercising and they are eating like really good food and a lot of vegetables and fruits and like the whole grains and the less processed food, they will have not as many symptoms as the women who eat who eating habits are not good.
So, Dr. Anju, like we mentioned about BHRTs, or the bioidentical hormone replacement therapy.
Yeah.
So, where do we start with this? Does women really need to go on BHRT?
So, in first of all, like in the years ago, like many years ago, like they were when all of a sudden like the women were going crazy with this, like okay, the menopausal, like then they were using just the traditional estrogen replacement, and then which has so much negative effect with
and those were the synthetic hormones.
Synthetic hormones, and also if in the initially when it was like only the estrogen was used for the replacement therapy, then women were having more risk for the endometrial cancer.
Right.
So then it was then the progesterone was added, which cuts the the risk of the endometrium cancer. But again, there is a risk for the breast cancer with the traditional synthetic hormone replacement therapy.
Right.
So which is not, we do not recommend that, and there is always the natural hormone replacement therapy, which is as benefited as synthetic, or
better than synthetic.
Better than that.
So to the listeners,
and without any side effects.
Right. To the listeners, I want to make sure that we all understand the difference of bioidentical hormones versus synthetic. So the synthetic hormones are made it look like our natural hormones.
Yes.
And they are developed in the lab in a different way. Whereas the bioidenticals, the sources are usually natural resources from the plant-based hormones, were taken rather than the animal source of hormones, which were like you mentioned, like in Premarin and all that, which were indicated causing the cancers of.
Yeah, that is from Premarin is from the the horse urine.
Yeah, and then it was later on.
It was mentioned as the natural because it was from the horse urine, but that estrogen, it's not the same as body's human estrogen is.
Right. So the plant-based, all those, even though no matter how you call it hormone. Now, majority of the hormones which are in the market, which are marketed, are plant-based now. There are very few synthetics are left
There is still synthetic been prescribed, but there is availability of the bioidentical hormones. It's not patented. It's because there is not so much research has been done
Right.
on the bioidentical hormones, but it is effective and the better than the synthetic hormones and without any side effects.
Right, and the side effects are always controversial. Even with the bioidentical, there have been not enough research available where we can right now say, but they're at least considered safer than
the synthetic ones.
So when we say bioidentical, what it means that molecularly, we have these hormone which matches the way our body produces, but the originating source is usually plant based, and that's what is used. And there are more than 23 different type of estrogen hormones, and basically we go after the three main estrogen hormones, like estriol, estradiol, and estrone.
Yeah, and the estradiol is the strongest one.
Right.
And now they use the all three. In the past, it was not like the
Right, they were used as a triest, but because the US FDA has an issue, and we are now only using two majority because that's what's been told. But the Europe is still ahead of us, and they're still using the combination of three, and which is estradiol, estrione, and estriol. So estrone, estriol, and estradiol. These are the three combinations which get used in Europe, and they're fairly successful. In US, we have to, it's the compound pharmacies which now do that, but the majority is bi-est, which is a two estrogens combination.
Then it's always with the natural too. At my office too, we use the progesterone along, even if we are using the phytoestrogens because it has so much good effects. And if the women are surviving with all those issues I mentioned earlier, it's not bad to use the bioidentical hormones, but it's
only when needed.
Only when needed.
Right.
If it's really needed. If you are suffering with you're not sleeping, you are depressed, you are anxious, you have all those things which is really deteriorating your life, then some hormones can be it's in the different forms. It can be the cream based, which can be used topically. It can,
and usually what I find is the topical use is better than the
oral
or the injectables.
Yeah, so it's also sometimes it's these days it's the over the counter available too. Sometimes dosing is how much to use is really it's not as effective as it should be. Sometimes it's very low they are using, or sometimes we do not want them to use too much either.
So with the bioidentical, all those creams and topicals, it's managed with the individual based
and also see a doctor. Take some help. Do not go just the over the counter things and start using those.
Right, and we see all these kind of effects. What actually hormones can help to control fatigue, bloating, a low sex drive, and thinning hair is not really. It's somewhat controversial. It's not that it will do everything what we expect it to, because at the end of the day, you are still taking hormones which is not produced by your body. And so they do not have the same effect.
Yeah, and it's always good to have the progesterone is the safer one. So
Right.
progesterone should be used
In combination.
along with the estrogen. If you have to use estrogen, use the progesterone along with it.
All right. And so it shouldn't be just plain estrogen therapy.
Yeah.
It shouldn't be. So it should be always.
And it's sometimes some women like when we are using the estrogen, and if I will just go over when we have the first 5 days, and after first 5 days the estrogen starts increasing in our body, and then when we have the ovulation, and then it's the progesterone starts increasing into the body. So when it's so interesting, then if we are doing the estrogen, and then sometimes we just use the estrogen and then we add the progesterone, and then we ask, okay, no hormone for few days, and then some women will have just a small period, and
Right.
which is good, which is the normal.
That's how we want the
We
physiological.
want to be, and especially if I do that, like with my women patients, like in their early 40s or like they are young, so which is more beneficial that way
Right.
too. So then there is the other hormones too, like the DHEA and the
Which are the precursor
hormones.
And the testosterone, I mean, a lot of women may be wondering why we're talking about testosterone. Even women do carry testosterone, and same way men do carry some of the
Estrogen.
estrogens, right? So it's not that we biologically different, but not whole lot different. There is it's a ratios, when testosterone dominates in male, and in women estrogen dominates more.
Yes.
So but they do have level of testosterone, which is actually very important, which they do need it.
They do need it, and sometimes like the some women, like the some testosterone can be prescribed too for the different reasons.
If they're
for
lacking.
the different
So,
reasons.
Dr. Anju, when we prescribe, we talk about it. There are different testing methodologies because there's really no hard way to test all the hormones in perfection.
Yeah, no.
Because it changes day to day.
That is not possible. That is not possible.
And a lot of patients come to us and, they talk about what different testing methodologies you can use to individualize. So it's, saliva tests are done, and then it's not really very much the confirmatory test either. So, if you're going to do saliva tests, usually certain labs, they kind of want you to take a saliva every morning, and for particular amount of days, like almost 28 days of samples, and then it run through the testing methodology to see how much variation of the hormones you have day to day. And then we have blood work, which tests you, and it can also be variable.
It's also variable, and sometimes it's recommended to just after the periods too. But again, like it's a different timing throughout
Can
the
affect
month.
throughout.
Can affect.
But if we do kind of few routine blood works, it can give us an estimation.
Yeah, especially
how
with the menopausal women, I do like to do a baseline, so we know that what the estrogen level is, progesterone, and if they are on the bioidentical hormone, they are on the hormone replacement therapy, then it's important to do like what are the estrogen levels. I do check like the if I'm doing the therapy. That what their levels are for the estrogen and progesterone, and also for the DHEA too.
Right, and then we also look into the like LH and FSH, see what their status level, if they're really
If they are just perimenopausal
or
time.
not, because that indicates if the anterior pituitary, which is our master gland sitting in the brain, if it is trying to push it, that's an indirect indicator.
So the LH-FSH ratio increases when you are perimenopausal, or so it's not working the same way.
Right. So that's one way of our doctors to find out if you are, if your ovaries, the target organs, are kind of, just giving up on you. So that's one of the way. Other thing is we also, some of the hormonal effect are also actually taken over by the adrenal glands, even though the adrenal glands are the small, tiny gland sits on the kidney top. But they do also participate when needed to produce these hormones. So the health of adrenal gland is as much important beside as taking care of the ovaries.
Yeah, and because
uterus
that produces the lot of the steroidal hormones
as well.
And the DHEA, which is not like the estrogen, progesterone, it's a certain time when our body is producing that, but the DHEA is produced all the time.
Right, and that's the precursor, that's the mother hormone.
Yes.
And that's so now, folks, now you understand when we're talking about the lifestyle and issue, why lifestyle, the diet are affecting us the way it makes your hormones go down or up, or make you feel stressed out. So all these stress hormones are affecting actually the adrenal gland.
Adrenal glands.
So taking care of your adrenals is very important, especially if you're in a very highly stressful job. There have been studies done indicating the couples, who have been on high stress job, they usually have no sex life or at all, because their hormones are so low that because of the stress factors they are not sleeping well, and our hormones are not taking into the circulations, and these guys are not eating properly, so that changes the whole outlook of the hormones.
Yes, that is very much true. And if we talk about the Ayurvedic concept,
Right.
so this one is like it's from the it's a transition from the Pitta phase to the Vata phase. So which is also like the women who has like the significantly Pitta or Vata imbalance in the years before the menopause, they will have this more. Their transition will be more tough. And then again, like as we mentioned earlier about the food wise, like the women who eating well and not eating well, it's again like they have the toxins into their, which we call with the Ayurvedic more ama into the
In the gut
system, into the gut, would also affect.
Right, and it affects all the different channels.
All the different channels, because it cannot be transit properly. And then the third factor would be the stress. So stress is the major factor too. It's a misuse or overuse of the mind, body, and emotions that happens. And then when women are like due to the job related or with the children or with any reason, if they take so much stress, because that really imbalances the vata. So all those factors will also affect your this transition.
Right.
So
why don't we take a short break, Dr. Anju, and we are talking about the bioidentical hormone replacement therapy, and we'll come back after the short break and we'll discuss what we can do and when BHRTs are really needed and how dietary and lifestyle and yoga can affect. So folks, if you still have a question, you can call us at 1-844-301-1250. Again, 1-844-301-1250, and we're talking about bioidentical hormone replacement therapies.
If you're suffering with diabetes, heart disease, hormonal issues, digestive issues, and other chronic health issues, we offer comprehensive Ayurvedic and naturopathic treatments to reverse your diseases. Call us at 425-453-8022 for more information. Panchkarma detox treatments are a great way to utilize natural healing mechanisms of the body. Our clinic in Bellevue, Washington offers over 36 years experience in Ayurvedic treatment. Call us for more information about our Panchkarma treatments at 425-453-8022. That's 425-453-8022. If you or someone you know is diagnosed with cancer and is interested in adjunctive holistic approach, please come and meet our doctors at Ayurvedic and Naturopathic Medical Clinic or call us at 425-453-8022. That's 425-453-8022.
All right, folks, thanks for staying on with us. So we are talking about bioidentical hormone replacement therapy. So before break, we mentioned what are the things we should be looking at, and Dr. Anju, you have some suggestions.
I just mentioned like before the break, what are the Ayurvedic concept, how it would be. So now like the little bit of the dietary tips to manage the menopause. So if it's like the Pitta related, if Pitta related symptoms would be like the hot flashes, irritability, those are the Pitta. So we need to do the Pitta pacifying diet.
So that's cooling diet.
That's the cooling diet. So we need to avoid all the spicy food, fried foods, chilies, cayenne, black mustard seeds. So those are the things
and
we need
also cut down the red meat.
Cut down the red meat, and the yogurt is not recommended, but like the we call it lassi would be good for for that issue. And also like the lot of like the vinegar is also need to be avoided, and
not too much.
Not too much, and need to eat the food which are bitter, astringent, and sweet. And those foods would include most of the vegetables. The astringent foods would be, and sweet foods would be like the rice, milk, and sweet lassi, those type of things.
And by the way, in the summer they taste really good. So the sweet lassis you can make, and maybe you can give a small recipe at the end.
Yes, and also like the plums are in the season, pear,
Right. So
those would be the pitta pacifying too.
and make sure, folks, that when you buying the fruits, these have to be organic, pesticide free, and
Because all these things affects your hormone. And if you are non-vegetarian and if you eat the
meat and
meat
poultry
or the chicken or fish, it has to be organic
or wild.
like it's because we do not want to put extra hormones into our body, and the fish has to be wild because with the farm raised fish there is like the lot of toxic issues and that really affects,
And the feed
that can
which
affect
is
your
given to
hormones
the
too.
fish is actually the culprit in the farm
Exactly,
raised. That's the culprit
exactly.
because they do give some the food which is has all these chemicals, and that what affects the meat. And sometimes they give certain things because they need to grow to the certain size.
The hormones, they use the
Right.
hormones too.
So that's the reason, and certain colors are given
Colors
to the
are given
to
too.
the fish to so their skin looks like
Also no canned fish because that is also bad.
right. So only the canned fish, and that because again the coatings and all that
Yes.
are the factors.
Yes, and then like what other things? Okay, the spices. You need to cook the food with the pitta pacifying spices like coriander would be good, cinnamon would be good, fennel would be good, and so avoid chilies and all those, but you cook with the other pitta pacifying. So if we have the vata related symptoms would be the memory loss, lot of dryness, vaginal dryness, and these would be the due to the vata imbalance. And so you need to eat the food which is more cooked, warm, and like also need to some small amount of the fats can be eaten too, like the ghee is good, some avocado oil.
And a lot of people
Olive
have
oil.
this issues around the fats, but fats are not bad.
Fats are not bad. It's your like how your body is. If you need to look into your, even if like your cholesterol, sometimes people think, but you need to eat the right kind of fat.
Right. And remember, all these hormones are actually fat driven because we need a fat in our body to make those hormones. The cholesterols are needed to make our hormones. And for example, the women who are very thin and bony, and usually they have all these issues around their cycle and period, is because they don't produce hormones because the lack of the fats.
Yes.
Or not absorbing fats.
Yes, that is true.
Okay.
And then need to eat like the lot of cooked vegetables. Need to eat more like the instead of the summer salad is good, but not all the time. And eat more like especially the cruciferous family vegetables.
And those are like
the broccoli, cauliflower, Brussels
Brussels
sprouts.
Yeah. So these are they
Cut
can
down
be
the bell pepper because all these cruciferous family does increase your vata too. So
Yeah, but
if you need to eat one or other and eat in the small amount and but the cooked.
right, and then add certain spices. Which
Spices
balance.
like like the garlic can be added.
Ginger
can be added.
fresh ginger
Fresh
especially.
ginger is great. Also like the cardamom would be good. Cinnamon can go both ways. So cinnamon is good too.
Yeah, it's a kind of balancing.
Balancing.
Both ways.
Yeah, but it's good for the pitta balancing too. And need to drink lot of water throughout the day.
Right.
And I do not recommend like the ice cold water, and just the room temperature water would be great.
Mm-hmm.
And then also like
Hydration is usually a good indicator anyway, because I usually tell people that if your skin is kind of a little bit dry, that's an indication that you're not drinking enough fluids. So keep up with the hydration. And the good thumb rule is that half of your body weight in ounces. And that's a good way to hydrate.
Yes, and the other thing would be with the vata, with some massage with the vata pacifying oils, like the ashwagandha oil is great too.
Yeah, sesame oil.
Sesame oil would be good too, because like the massage
In general is great.
Massage in general is good, but just like for the women complaining about the sleeplessness, insomnia issue too, the massage would help them. And also like make a routine, try to go to the bed by 10 or like get up by 6, and also like little bit of the herbs, like some herbs can be very beneficial too. Like the sitavari is a great herb too.
Right. So especially like Dr. Anju mentioned, the women who are kind of perimenopausal, they have a sleep insomnia issue. So what would be your recommendation if they really keep on facing like insomnic issue or where they're not able to sleep? So what would you recommend?
So I would recommend them to like the as I mentioned, like the sitavari. That's a great, like they need to take some of the herbs which will help them if
And
they are not planning to go for. Sometimes if they are planning to go for a, it depends. If they really have those bad symptoms, they can have the bioidentical hormones.
Okay.
And otherwise, if they need to take some herbs, then there is like some herbs available, like the sitavari is great, ashwagandha is great, and also like the chestberry, black cohosh, those type of herbs are helpful. Yam, which is like you know like
the yams are actually they do contain all the
yeah, but like
phytoestrogens.
again they have to be like it's a process. It's like just from the yam you cannot have like really, but it would be good. But if you really
It's a
need
good
to,
food.
it's a good food. But if you cannot take that for a hormone
As a
replacement therapy,
yeah.
because that is like different story.
Right. The thing is, you have to have in conversion, and it doesn't work that way.
So
right?
that is like that is like the hormone needs, it's need to be processed so we
Right.
can have that.
So in a other way, I usually tell that we need to do the foods which really supporting the gonads, which supports the ovaries, which supports the adrenal glands, which supports your thyroid gland, and all these.
Yes, and having a
glands.
cup of milk, the coconut, I usually recommend like if you can take the dairy, then you can have the cow milk, make it with by adding the curcumin into it, and like some nuts and seeds, like
And
the
cinnamon is a great.
cinnamon is also great for the sleep, and you can have like the soaked almond hemp and chia seeds, and you can make a drink with it. With the dates would really works as a sweetener.
Right,
into
and
it
that's
too.
like a tryptophan enhancer in the body.
Yeah, and then
serotonin,
making
tryptophan.
that drink at night, warm drink, would be really helpful in the sleep as well too.
Right, and milk is actually a very healthy food only if you can handle it. That means if you're not known
And
to
then
be
it's
allergic.
again like the soy is great for the menopausal symptoms too. It has the estrogen. It's really, but sometimes it's some people cannot take it. But if you can take the soy, that is the natural way of the having the
On the
increasing
soy,
the estrogen.
Yeah,
too.
on the soy, I will just say make sure you're not buying GMO soy. There is a natural soy available, which is not genetically modified, and there is organic soy
Yes.
available. Though in the U.S. market, I think 70% of soy is GMO, and even the eating tofu and the soy milk may not be from the natural, the original soy. So the GMO soy is not considered as a very healthy choice. But if you need, we need to make sure. So anyway, now what else, Dr. Anju?
So those are the some like the Ayurvedic concepts like I wanted to discuss, like how
And
to eat
I
it.
think the other thing which I want to tell all these women who go through menopausal phase and the perimenopause, the yoga is a huge thing, and doing shitali, breathing exercises, pranayam, and making a yogic routine. That means having a yoga exercise routinely helps, and it actually not only increase the flexibility, but it also keeps your bony structure strong.
Yeah, and also like I would like to add, like by taking the menopausal women need to take, because our calcium is very important to take due to the osteoporosis issue.
Right.
So, and taking a good multivitamin, calcium, and the minerals is also as important.
Yeah, and you can, a lot of people say how much calcium we should be taking. Well, if you, 800 milligram to 1200 milligram is usually recommended dosage for the calcium, and usually calcium which you need to take is need to be good quality calcium, which is bioavailable, which your body can do it. So, carbonates, the calcium carbonates, which is mostly available, are poorly absorbed, whereas the citrates and malates are better absorbed in the system.
Yeah, so if you are really suffering with the bioidentical hormones, or the phytoestrogen and the progesterone is recommended. And we do that at our clinic. Our clinic number is 425-453-8022. So we always, whenever we get these type of issues, we always start with the giving some sporting herbs and supplements.
Dr. Anju, my first approach is always natural.
Natural,
Working with the diet, working with the
these
herbs.
herbs helps with the, even after like you have menopause, this still works with the organs to balance the hormones. And if that is not enough, then we do the bioidentical hormones or the hormone
and
replacement
sometimes they are
therapy.
needed, and it is
Sometimes it's needed. Some
and
people,
the reason people who have an hysterectomy, who have no ovaries, no uterus, we need to give them in order to, if they're young.
yeah, but
to support
definitely
them, but
I
not for the long
recommend
run.
like not the synthetic ones, and because the bioidentical or the phytoestrogen and progesterone is like they act like our own hormones.
Right, like I mentioned earlier, there are availability, the hormones which are from the natural plant sources are better handled by the body, and there is less toxicity from here, and also considered a little bit less safer, though there is not whole lot data available, but still considered safe. So hormone therapies are really, when needed, we do it. So, folks, I and Dr. Anju both been practicing at Ayurvedic Naturopathic Medical Clinic in Bellevue for over 30 years. So, if you need to discuss any of these issues, feel free to call us at 425-453-8022. Again, 425-453-8022. We'll be very happy to take your case. And we really appreciate listening to us today on hormone replacement therapy.
Thank you.